Where are we going to go? Okay, so we were at the objectives of the talk. And so we're going to talk about about the importance of clear bidirectional communication to health outcomes. And also we're going to review the resources and best practices to assist with communication for both patients with limited English proficiency and for those who are deaf or hard of hearing. So to start with limited English proficiency, there are at least 350 languages spoken in the United States, and more than 25 million people in the US speak English less than very well. So how can we navigate the barrier of limited English proficiency with our patients? And the answer always seems really simple. It's use an interpreter. However, we know that this is not always what happens because varying levels of language proficiency amongst the providers and then also amongst the patients and family members make this a bit more complicated. But we also know that in Los Angeles, this is really an issue at the forefront of medical care. So this map illustrates the percentage of people 5 years and over who speak a language other than English at home. And so if you identify Los Angeles County on this, you can see actually the majority of people in Los Angeles County speak a language other than English at home. So this is definitely something that you have to think about and be prepared for in order to practice medicine here. In addition to that, we also know that within Los Angeles County, there are over 800,000 residents that are living with either deafness or hearing loss. And so, also thinking about and having tools to really achieve communication with them as well is very important. And so we also know, though, that the underuse of interpreters in medical settings is really pervasive. So the literature is clear, kind of throughout different clinical settings. Even when formal language assistance is available, providers tend to underutilize it. And the status quo is really kind of getting by or muddling through, either with the use of ad hoc interpreters or limited language skills of the provider themselves, because oftentimes it's considered a trade-off with efficiency. And that's really something that we've seen throughout the years and that we're trying actively to change, especially at All of You, to make it clear that, even though it may seem like a trade-off of efficiency in that moment, that for the long term and for the patient's understanding and for the high quality clinical care, it's important to take that time and call an interpreter and make sure that we're achieving communication. So I just want to say a word about medical Spanish. Medical Spanish classes have become very popular in health profession schools, but the question is, does learning medical Spanish help patients? The answer is no, not really. What we know is summarized by this quote from Lisa Diamond, which says, brief, intense language training in groups of medical trainees with otherwise limited Spanish proficiency may lead to diminished use of interpreters as well as significant communication errors. So this is something to strongly consider, as many of you have probably taken medical Spanish classes, that you want to be really aware and humble and culturally humble and understand that, if you have only limited language skills, that interpreter use is still required. Okay. So we also know that patient outcomes improve with formal language assistance. So patients, when formal language assistance, i.e. the use of professional certified healthcare interpreters, patients experience fewer hospital revisits and discharge instruction adherence approaches that of native English speakers. So it's very important, to get those certified healthcare interpreters involved. Beyond that, there's also a legal basis for the right to language access on the part of the patient. So this is the legal framework. This is Title VI of the 1964 Civil Rights Act, which states that no person shall, on the grounds of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal assistance. So the Supreme Court has formally interpreted the phrase national origin within this quote as being the right to language access. So it applies to what a person's native language is. And so that's the basis for the right to language access across healthcare. And then there are some other regulations that actually make this more specific. So Section 1557 of the ACA also states that it has to be a qualified interpreter. So as a hospital, we're required to provide not just language access, but specifically by a qualified interpreter. And that is, why we, hospitals are sure that they're providing, these certified healthcare interpreters, and that things like the language line is available. And just, another point is that the right to access for someone who is deaf or hard of hearing comes from a different legal foundation, and that's the Americans with Disabilities Act. And just to point out that that's a bit different, and it actually, really covers access in more specific terms. And so patients who are deaf or hard of hearing, it's very important to identify what their communication preference is, and then work with them to try to achieve that communication preference. So what are some strategies for improving your own communication with patients who may have communication barriers with their providers? Number one, first of all, most important, be aware of your patient's preferred language. So make it a habit to look in the chart, because it's recorded by the registration workers when the patient checks in what the patient's preferred language is. So in the emergency department, we have an icon on our tracking board that, it's not this one exactly, but it's a similar one that tells us, before you even open the chart, that this patient requested an interpreter at the door. And so just to give you a sense of how common this is at all of you, about 57% of our patients or so request an interpreter at the door, and about 97% of those requests are for the Spanish language. So if you're working on the floors, you may have to actually open the chart in order to see what the language or communication preference is, but it is there and it's available. And that avoids that awkwardness of like walking in the room and then realizing that the patient can't communicate with you and then having to like backtrack and go find an interpreter, right? Okay, next, this seems to be one of the biggest barriers, is actually picking up the phone and calling the interpreter. So, this is Laura, who's pictured here on this slide. She's she's for a long time was our only in-person interpreter in the hospital. Now we actually are undergoing a language services expansion. And so we're hiring additional interpreters, but Laura is the one who you'll see walking around the hospital, who's kind of in charge of this language services expansion, and is in the process of training the other interpreters as well. And so we also have these dual handset phones, and we have the video machine interpreters as well. We're actually, as part of this expansion, we're swapping out these the video machine interpreters for iPads. And so that is not in place yet, but it's something that you will see during the course of your residency. Okay, so how do you access language services at all of you? From any phone, if you want a remote interpreter from any phone in the hospital anywhere, you can call this number 73298 and get connected to our remote interpretation service. As I mentioned, we have this language services expansion going on, so we're adding on additional in-person interpreters. We are moving from 1 in-person interpreter to 10, so that's really exciting for our hospital. But so because you're kind of entering when we're in the process of doing this, you'll have to keep your eyes open. We're putting them, one by one as they're trained into different clinical situations. So, keep an eye out so that when one gets assigned to your department, how to actually page them. There's going to be both a VoIP phone number that you can call, and then also a pager number. So you just have to look out for that announcement when they come to your area, and you'll know how to find them. As I mentioned, we also have multiple video machine interpreters currently, and then we also are adding iPads to that as well. Make sure that you know that the video screens are available, because that's what you're going to be looking for if you have a deaf or hard of hearing patient, right? And then there are different types of deaf or hard of hearing interpreters as well. And it's important to remember that we have contracts with different types of certified deaf interpreters. And so if you're having difficulty, you think that the patient is not able to see the video screen, or they're not using American Sign Language, you can ask the charge nurse in your unit, and they can help you to contact the other types of deaf interpreters that we have. Okay, so just some basics about how to work with an interpreter, right? Because this is not uniformly covered in medical school, so it's important just that we think about it for a minute now before you start your residency. So when you're working with an interpreter, make sure you're using the first person. So you're going to speak directly as if you're speaking to the patient. The only difference is that you're going to pause in between each sentence and give the interpreter a chance to interpret. You're going to speak loudly and clearly enough that the interpreter can hear you. Speak at a normal pace, and then make sure that you give the interpreter a chance to finish speaking before you start speaking again. Try as best you can to avoid acronyms, slang, jokes. I mean, this is all kinds of things that we do for, making sure that we're using accessible, simple language in healthcare anyway. Make sure that you acknowledge cultural differences. And the other thing that's really important to think about is the interpreter, especially if you have an in-person interpreter with you, they're part of your team. So, if you're walking into like a really emotionally charged situation, make sure that you talk to them beforehand so that they know what they're getting into, right? It's helpful for them to prepare. And then also, if you're going to debrief, if there's an unexpected outcome, include them in your debriefing as well. So this is just a good picture of an appropriate setup for working with an interpreter. So, they're kind of positioned in a triangle. Everyone's able to make eye contact with each other. Of course, this is a mom in a pediatric clinic, but, they're having a conversation with the mom. So you can see, everybody is engaged and the physician is talking directly to the patient and making eye contact with the patient as they're speaking. Special considerations for deaf and hard of hearing patients. As I mentioned, you can't assume that people use American Sign Language. So the first thing is that you have to try to figure out what is the patient's communication preference. And so sometimes patients will bring friends or family members with them to let you know what the communication preference is. Sometimes they'll bring a card with them in their wallet or something and they'll hand it to you. But your first job is to try to figure out what that communication preference is. Additionally, friends and family cannot be used as the interpreter themselves. The patient has to be offered the services of a certified interpreter from the hospital. They can refuse those services and then they can choose to use an adult family member or an adult friend, but they can't be used as a first go-to option. So just because the family member is sitting there and they might seem like a convenient option, we have to offer a certified healthcare interpreter to the patient, both for limited English proficiency and for deaf and hard of hearing. And the only other thing to say about this is that, if you're having trouble determining their communication preference, one of the things you can do for deaf and hard of hearing patients especially is just get the ASL interpreter on the video screen, and the ASL interpreter can actually help you to identify the communication preference. Okay. The other thing to mention is that just remember, everything is visual, right? For a patient who is deaf or hard of hearing. So make sure that the room lights are on, make sure that the video screen is moved up very close to the bed so that they can really see what's going on. And here is a good illustration of a good room setup for a deaf or hard of hearing patient. You can see, although the screen is small, it's rolled right up to her bed so she can see exactly what is going on with that interpreter, but also she can look up and see, kind of the facial expressions and nonverbal cues of the provider as well. Just to remember, document your interpreter use. If you're doing the right thing, you want to make sure it's documented as well. This is a note that has a good documentation at the top. It says Pacific Interpreters, Interpreter Jessica, and the ID number. And then finally, the last point that I want to make is just that, this is the communication triad. It is made up of language assistance, cultural humility, and usable health information. So language is just a start, and it's important to remember that. And there are other considerations in achieving good bidirectional communication, but we can't get there unless we make sure that we are communicating, with appropriate language assistance first. And so the summary of main points, I just want to make sure, the message from the Department of Health Services of Los Angeles County is that we strive to achieve clear bidirectional communication with all patients, right? providers are responsible to offer and provide interpreters for patients with potential communication barriers, both by law and by DHS policy, and that family or friends should not be used as interpreters unless the provider has specifically offered the services of a professional interpreter, and the patient has declined, given a reason for the declining, and then chooses to use that person as their interpreter. So you have to formally make that offer and then document that you did so, and that children can never be used as an interpreter. Here's my contact info if anyone wants to talk about this any further or has questions. And so I'm going to stop my share now. And so now what we'd like to do is we have a survey